everybody. Today we're talking about pregnancy health. When the mother's pregnant, she should definitely be eating a healthy, balanced, well diet. And so following the MyPlate guidelines can be very helpful. Normally with the MyPlate guidelines, you are eating half of your fruit plate should be fruits and vegetables. And so you want to eat a variety of fruits and vegetables. That will give you a variety of different nutrients. For your grains, the mother should be eating whole grains, and that gives a lot more vitamins and minerals than the more refined down grains that you'd get for white bread or white rice. Protein-wise, you want lean, healthy cuts of protein, and then making sure that they're getting plenty of the dairy group. 2 to 3 servings of milk or yogurt will give you plenty of calcium to help build the baby's bones. Vitamin-wise, we're going to concentrate mostly on what it does for the baby. Folic acid is really important because it helps prevent nervous system birth defects. And so you're going to find that in any prenatal vitamins. A lot of doctors will ask the mother to take prenatal vitamins in order to make sure that they get plenty of the vitamins for not only themselves, but also for the baby. The B vitamins are important for nerve cells and the formation of red blood cells. Vitamin A helps with developing cells, but it also helps develop the bones of the baby and the vision. And then vitamin C helps produce collagen, and collagen helps give structure to the baby's body, to the bones, to the muscles, to the blood vessels. And so that's another really important vitamin to make sure you're getting plenty of during pregnancy. Mineral-wise, calcium is important for building strong bones and teeth. And even though babies aren't born with teeth, they have the buds of the teeth in their gums so that when they are born and later on will start teething, those teeth have already started to develop when they were developing during pregnancy. Iron is another really important mineral for both mom and baby. It helps create the blood supply of the fetus, and it helps supply them with oxygen as well. Iron is one that is important for the mother as well. Usually that's something that they'll watch after the baby is born because a lot of mothers have an iron deficiency and may have to take some supplements. So making sure you're getting plenty of it during pregnancy can be helpful to prevent that. Typically with the vitamins and minerals, the mother's body is going to give what's taken in to the baby first, and then the mother gets what's left. And that can leave the mother with some deficiencies in it. So she needs to make sure she's eating enough to be able to take care of herself as well. Exercise is another important part of being healthy. And so exercise programs, there's a lot of them out there. And when you're thinking about different exercise programs, it would be important to talk to the doctor and make sure that it's safe for the mother. Walking is really very easy and not very strenuous, and so that should be a pretty good exercise for any person. Other exercise programs, you should definitely talk to the doctor and make sure that they are safe for mom and baby. Be careful when you're exercising. The mother should be drinking plenty of water and making sure she doesn't get dehydrated. Also avoid getting too hot or too cold. So you wouldn't, in the middle of summer, a mother wouldn't want to exercise during the heat of the day. Morning or evening might be better options. In the winter, when it's really cold outside, maybe being outside and exercising outside isn't the best option. So maybe finding a gym or a place at home where the mother can exercise would be good. Watch balance. That growing belly sometimes can throw somebody off and cause the imbalance that may lead to falls. So you want to watch to make sure that you're doing things that you wouldn't have to worry about falling. If any pain is experienced during exercise, the mother should stop and call the doctor and let them know. Make sure that they are being taken care of. Sometimes getting some water and just resting can help take care of the pain, but the doctor should be aware of what's going on as well. Typical weight gain, it kind of depends on the mother's body frame, but usually it's somewhere between 25 and 35 pounds that the mother should be gaining during pregnancy. And so you would want to talk to the doctor, and the doctor could give you maybe a better amount or idea of what the mother should be gaining based on her body type. Now, caffeine is something, it can be something that you may need to watch to make sure you're not taking in too much caffeine. Sometimes caffeine can increase your risk of miscarriage. It also takes away fluids and calcium from the body, and those are really important during pregnancy. So you don't want something that's going to could cause more dehydration. And calcium's building the baby's bones and skeletal system. So you want to make sure you're not getting too much of the caffeine that could be taken away from that. It can also interfere with iron absorption, and so that would make it harder to get enough iron. It is a stimulant, so it can prevent the mom from getting enough rest. It can keep her awake, but during pregnancy, it's important to get enough rest to help fuel the growth of the baby. It can also make mood swings worse, and a lot of times women, especially at the beginning as hormones are changing, can have some mood swings, and so caffeine can add to that during that time. Teratogens are substances and exposures that cause birth defects, so it's definitely things that you want to avoid during pregnancy. Examples of things would be alcohol. Any amount of alcohol is not safe during pregnancy. Smoking is also can cause birth defects. Drugs, whether it's illegal or prescription drugs, you really should stay away from those. Prescriptions, you would want to talk to the doctor to see if the things that you are prescribed are still safe while pregnant. Even over-the-counter medicines, there's a very short list of things that you can take while you're pregnant, so the mother should talk to the doctor and make sure that she knows what is safe for her during that time. And it also can be fumes, things that you breathe in. So any kind of fumes you kind of want to stay away from. Painting you can leave to the father, or other things that would be detrimental if you're breathing it in. So stay away from harsh fumes. Fetal alcohol syndrome can be caused by drinking during pregnancy. It's the leading cause of mental retardation and results in things like facial disfigurement. So if you take a look at the picture, it kind of points out some of the facial features that can be typical of a child that is born with fetal alcohol syndrome. They may have a smaller head, the bridge of their nose may be lower, smaller openings of their eyes, the nose is shorter, the upper lip tends to be a little bit thinner, the jawline may not be as developed as a child who would not have had fetal alcohol syndrome. A flatter face, so things like that can be more visible. Sometimes coordination-wise, they can be clumsy. Behavior problems, they might be the child who's more likely to get in trouble in school. Stunted growth, they don't grow as tall as what they could have or should have. And attention span can be really short. They can't focus on things for very long. Memory-wise, that could be another thing that shows up when they get to school, that they have a hard time remembering things. And then, of course, drugs can definitely be something that can cause a lot of issues for babies. Anything that the mother takes in during her pregnancy is going to go to the baby. And since the baby is so small, it's going to affect the baby a lot more. So drug use for the baby as it's developing, it can cause birth defects. It is more vulnerable between weeks 3 to 8, and at the beginning of that, the mother may not even know she's pregnant. So she could be doing something that can put the baby at risk even before she knows. It can reduce the oxygen and nutrients to the baby, so they're not growing as well, and could be a lower birth weight when they're born because of that. It increases the risk of a premature birth, and that baby being born early. It can also cause miscarriages, that the baby is unable to become a viable fetus. And then it can cause death as well, that maybe later in the pregnancy, the baby dies before it would be mature enough to be born. The baby can also be addicted at birth, and so it would have to go through withdrawal after it was born, and it's very hard on the baby when that happens, because it doesn't really understand what's going on. They cry a lot, they're hard to console, and so that addiction process or withdrawal process is something that the baby goes through in the hospital. And then once the baby's born, you can start to see other things that can be signs of fetal alcohol syndrome. So we're going to focus just maybe on the new baby up to about 2 years. And there's things that will show up later on as they go to school as well. But right now we're just going to focus on that earlier age. They may have problems with social interactions even very early, that they don't know how to interact. And again, that's something that may be more visible once they go to school and are in those social situations. It can increase the risk of breathing problems. Cerebral palsy is another increased risk for babies who have been born who are born with a drug addiction. It can delay their speech and language development, that they don't talk as soon or as well. They can have feeding difficulties, that they are unable to take a bottle as well as what they should to get the nutrients that they need. Sometimes you'll see vision and hearing problems, that their hearing and their vision didn't develop as well as they should have because of the lack of nutrients during the pregnancy. They can be more irritable, they cry more, harder to console. They have reduced cognitive ability, so that mental ability to think and reason and problem solve can be diminished. And another quality that can definitely show up later on when they're in school and trying to use that, the brain power to be able to learn. Fine motor skills, that's using the small muscles in their hands. So doing things like coloring or writing can be harder for them and not as well developed. And again, another thing that might be something more that you would see when they start school. They have an increased risk of having seizures as well. So if you have any questions, please feel free to ask, and I hope you guys have a wonderful day.